Filing an appeal is a good strategy to get things out of your insurance, except when it's not. Let's explore 5 good reasons when filing an appeal is neither right nor your right. Welcome, I am the medical bill whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. First of all, what is an appeal? It is a request sent to an insurance company asking for their review of a decision, a denial of coverage or authorization, or to ask for reprocessing of a specific claim. It is your right as a member per the terms of your policy, but also as a patient under federal laws. And filing an appeal is also a right for provider of services. But filing an appeal for any and all reasons will not always get you the outcome that you desire. In some circumstances, you have no right to appeal. Let's explore. The first one, incorrect claim info, or mostly patient data entry. If the patient's demographic information is incorrect, invalid, or missing, for example, wrong date of birth or relationship to the subscriber, you have no right to appeal. It is not the insurance fault if it rejects the claim. Same thing if a subscriber's demographic information is incorrect, or if the insurance ID number is invalid. And of course, if the wrong insurance is billed, you have no right to appeal. In cases where a patient has 2 insurance policies, billing the wrong carrier or order would result in denials with no right to appeals. Medical providers make errors too. For example, missing or invalid tax ID numbers, individual personal ID numbers, called NPI, occur too often, especially for out-of-network services. Incorrect or missing procedure, diagnosis, or place of service codes would also not be eligible for appeals. And a description is not enough. If you are paying upfront and cash for medical services out of network, but the invoice you submit for reimbursement is illegible, incomplete, incorrect, don't expect a right to appeal. Your insurance did not make any mistake if it cannot process the paperwork. If the medical provider did not submit required clinical medical records, indicate an authorization number, or if they failed to respond to a request from the insurance for documentation or information, there is no right to appeal. As for coding mistakes on the part of medical providers, they do lead to incorrect or rejected processing that cannot be appealed until corrections are submitted and a new explanation of benefit is generated. But patients' errors or oversights can also lead to denial rejections with no right to appeal, especially not responding to questionnaires or requests for details or clarifications sent to you by your insurance. Why did you go to the ER? Is a third-party liability involved? Is your injury workers' comp related? Do you have any other health insurance policy? Non-payment of premiums would also offer you no right to appeal, unless you could prove they were paid on time. HMO patients face another hurdle, billing the wrong payer. Now, an HMO is an organization providing medical services through a primary care physician located in a medical group or IPA. The premiums are paid to a health plan. They, in turn, pay that medical group and PCP to provide most of your medical services. Should you require external care, that PCP would issue a referral or an authorization. While most claims would be processed and paid by that medical group, some circumstances, including emergency services, out-of-area services, or care authorized under a specific agreement would not fall under medical group responsibility, but instead would need to be processed and paid for by the health plan directly. If a provider bills the medical group instead of a health plan, or vice versa, and that results in a denial, you would have no right to appeal, as the wrong financial entity was billed and therefore cannot issue payment. And if a patient provides incorrect insurance order information or withholds from their medical provider other policy details, claims could be denied with no right to appeal. It is called coordination of benefits and must be established between carriers to determine which one pays first. If a provider bills the wrong order or plan and a rejection or denial follow, then there is no right to appeal. I wish patients could determine which insurance to use or to use first, but there are specific rules such as the birthday rule, the eligibility start date rule, or the Medicare rule that come into effect and that insurance companies must follow and comply with in order to pay claims. Are there solutions? Of course. Correcting any error and resubmitting a corrected claim usually is enough. Submitting the necessary or requested information, documentation, code should reprocess claims with positive results. But the proper entity must correct its own errors in a timely and appropriate manner, and therefore not through the appeals process. So resubmit, provide, respond, fill out, return, and update by phone, through the portal, or through the provider, and stop wasting time and effort on filing an appeal with no chance of a positive result. Instead, save your time and save your money. Helping your insurance help you is the most effective way to get to that successful outcome. Filing an appeal when there is no right to appeal will only bring you further delays, frustration, lower chances of success, and unexpected medical bills. I so thank you for watching, for your subscribe, likes, and comments. It helps this little channel grow a little bit at a time to help more patients like you. Thank you.